Well, welcome to Sue Anderson from the Bark Park and Therapy Dog. What's the name of the Therapy Dog program?
Paws Hand Delivered, which is our local pet therapy group, and then our national organization is Therapy Dogs Incorporated.
We're having kind of a 5th anniversary here for the Yolando G Barco Oncology, and one of the things that's become a favorite of everybody is the Therapy Dog. So tell us a little bit about how that gets started.
I think the Therapy Dog started, I think, in 1994, and I think the main person behind it at that time was maybe Ruth Preston, Robin Peterson. Robin usually comes in sometimes on a Friday also. But the dogs have been involved with that, and when I got involved with the Bark Park, I think at that time we may have had maybe 18 or 20 therapy dogs in the group, and since we've been pushing it a lot more and doing a lot more with it, I think we now are up to 66 dogs.
Oh my!
That's fantastic.
And it's really quite a good program now.
Tell us about this.
Well, this is Danny, and Danny isn't sure that he likes this chair that he's sitting on.
No, I can feel him pushing against it, but that's okay.
But Danny is just 2 years of age. A therapy dog has to be a year old before they could even be a therapy dog. And the advantage of having therapy dogs, and I know that Meadville Hospital has been very adamant about this, if you were to take your dog into a nursing home and your dog was not a certified dog or a registered dog, and if someone were to trip on the leash, it's going to be your homeowners. Wow. Every one of our dogs is insured for $500,000, which really makes a big difference as far as the protection for you and also protection for us.
Do you know that? You're very valuable.
He's very valuable.
Tell us the kind of reaction you get, especially here at the Yolando G Barco.
Fantastic. And why we have a lot of people that visit here. We try and have a dog here at least once a day and sometimes twice a day. And most of our other visitations are done on a schedule where we have we go as a group, either either 1 o'clock in the afternoon or sometimes at 6:30 at night. But people like coming here because we've had the open visitation. We can come whenever it's convenient. Normally, Danny wouldn't be here today, and one of our regular people is not, visitors is not here.
I don't think he likes me.
No, he does. The regular person is not here today. So that's why we're kind of the backup, because we live kind of close, and then we decided to come over today.
Tell us about a therapy dog in general. What's different about a therapy dog from the dog in my house that isn't the therapy dog? It's my hunting dog.
Yes.
To what you want them to do.
People always ask me that. What's it take to be a therapy dog? And it takes, first of all, the disposition of the dog. And most of them have also gone through some form of a training. And they've gone through the basic obedience so that they will listen if necessary. People always say to me, my dog can never be a therapy dog. And I say, well, some of them do jump and some of them do have some bad manners. But the question is, how quickly, how quickly as an owner can you correct it? That's what does it. And then it's just a willingness to do a lot of things. Like our therapy dogs are not only involved here, but we're also in the library program, the special needs kids in Crawford Central, and places like that. We're there, we just started the adult read program and things like that. So it's dogs that allow things to kids to play with them, to touch them, and they're kind of low-key. Now, for a 2-year-old, he really does extremely well.
I can't believe he's bouncing off the walls.
No,
most young dogs have so much energy.
That's because I have him in a death grip.
Yes.
But basically,
So that's the secret. Okay.
But we started this. I think not Danny. I wish I had brought Martin with me today, because Martin started the program here 5 years ago. It was through Val Bond, and I think it was through. I can't. Who's the director? I'm sorry, I can't remember his name. No, the one that's down in Mind Body Wellness.
Dr. Bittman?
Bittman. He was in on that too. But Val Bond has been the greatest supporter of the therapy dog program ever. So
she was a great dog that came in with her every day to work. Yeah.
So she was the one that really supported it, and through her help and through her assistance, we were able to do something with the therapy dogs. So the people love coming here, and the patients love it. They get to know the dogs very well.
How does it benefit them, do you think?
Well, I've seen it happen, and I've seen it happen on several occasions where they're there maybe their first time getting their chemo, especially. They're very nervous. Through the blood pressure is off the wall. It's very high, and on several occasions, one of the people in the back will say to me, "Hey, bring the dog over for a minute." And you bring the dog over, and they pet the dog, and they talk to the dog, and honest to God, I've seen it on several occasions. That blood pressure just goes right down to where they're okay.
It's very soothing for
them.
And
a lot of them, one thing that people love to talk about more than anything else is their dogs. And if you say to them, they say, oh, I like this dog, and you make the comment to them, have you ever had a dog? And do you have a dog now? And then they usually just sit back, relax, and start telling us about their dogs and their experiences with them. So it makes a big difference. And with these guys right there with you all the time, yes, I know. I really, yes. We're very much in love today for some reason, aren't we? Yes, and you actually have calmed down now.
He's a sweetheart.
Yeah, he does very well.
Beautiful dog.
Bigger dogs do well. Smaller dogs also, because a lot of patients want to hold the dogs.
And those little lap dogs are nice.
Right. And even though they might be getting their chemo and things like that, having the dog sit on their lap and just for a short period of time makes a huge difference.
Oh, I can imagine. I know how much it means to me.
Right.
And I'm not getting treated when my little dog cuddles up with me
Absolutely.
at home. Yeah.
What do you think?
Oh, yes, you're wonderful. We'd like to ask you some questions, Danny.
He can answer. No, he probably doesn't. But he does very well.
Who does your hair?
It must be the same as you, but he's got the same coloration.
Well,
that's why I like it. Yeah.
But for his age, he does very, very well.
He's beautiful.
If someone was thinking about, well, maybe I'd like to have, a therapy dog, not at my house, but I'd like to be involved in that program, how would they go about it?
They usually the easiest way is to go onto the Bark Park website. Check that out and it tells you about it there. Something that's very interesting, one of my friends doesn't have a dog. She didn't have a dog until recently, and she wanted to have a therapy dog because she had once been a patient here and had dealt with the therapy dogs whenever she was a patient getting the radiation.
Yeah.
So whenever she started doing my website for me, she said to me, boy, I wish I had a therapy dog. And I said, well, you don't have to own a dog to have a therapy dog, but you have to be tested as a team. So I had my one dog, it's a Lasso, whose name is Roscoe. I said, well, why don't you get tested with Roscoe? So she got tested with Roscoe, and she comes in here with Roscoe now, which is her therapy dog. He belongs to me, but they're a team together.
They work together.
Right. So even though I'm a therapy dog person and Danny is a therapy dog, you could not bring him in. You have to come in as a team all the time.
Right. Oh, he
So
sees
that's how that
people
works.
outside. He's
He looks
on the
people and
alert.
he says, who is coming now?
He says, I don't want to miss anybody.
Someone else I can go get to greet.
Yes.
One more question. In a medical environment, a dog, at my house, dogs are in mud, they're digging holes in the yard and whatever, they're dirty, whatever. In a medical environment, any issues with that? Any concerns about it?
I had real concerns with that whenever we started. And I went and I talked to Dr. Alan Stanton at the time. And I said, what about this? I said, because of the dogs being in there and things like that. And he said, no, he didn't have any concerns about that. And I think we had talked with Betsy and a few other people in the chemo, and they said, if I'm not mistaken, I might not be using the right terminology here, but if someone's immune system was compromised, then they would not have contact with the dog. But the majority of the people, it's not a problem with them.
And you keep them beautifully groomed and clean to bring them in. I mean, it's not like our dogs that go out and
well, he was outside, but he was outside running beforehand, and he's
but
he's
you
classic
probably wiped his feet off. I don't do that with my dog.
I do that occasionally. What are you looking at, Danny? Is somebody coming?
Is someone coming?
He says, I'm going to give everybody kisses today.
Well, Sue, thanks for what you're doing.
You're very, very welcome.
Please pass on our thanks to the
Yes.
other folks in the therapy dog program.
And Danny, thank you for what you're doing and for being on our show. We appreciate it.
I can't believe he's been as good as he's been.
I know. Can we have your autograph?
I think things like the therapy dog and is what makes it different, what makes it special here at the Yolando G. Barco, celebrating our 5th anniversary. This is.
I'm thrilled to death about that.
Glad you could join us today. Glad we could get to meet.
Thank you, Danny.
Perfect timing. Okay, thanks very much for the invitation, and we'll see you again. We've got to go visit some people.
You've got work to do.
We've got work to do.
Well, and we also say thanks to the folks at home for joining us as always on Medicine in Meadville, and we'll talk to you next time.